So, to recap, phase 1 exercises are exercises just to kind of engage and recruit as many muscle fibers as you can in the idea of progressing to phase 2 exercises, which now is more of a functional type of movement pattern, which is going to include feet planted in the ground. So phase 1 are open chain exercises where your feet are not in the ground, and phase 2 are closed chain exercises where your feet are planted into the ground. So the most common, basic, fundamental, rudimentary movement that you need to do in a phase 2 rehab process is a squat, which can also be called a sit-to-stand exercise, and it can be used in a variety of patients. And this one is most commonly done in our activities of daily living, getting in and out of a chair, and it's also most commonly done incorrectly. So when done properly, you engage your quads, your calves, your hamstrings, and primarily your glutes, which is the one muscle group that most people don't engage during this activity. So, legs shoulder width apart, up nice and tall. First thing that you want to do is you want to create a hinge at the hips. Most people, when they go into their squat, they initially go into a forward knee bend, and that immediately creates a lot of ground reaction forces through the front of the kneecap, which is one of the reasons why we have so many people who come to our clinics with complaining of anterior knee pain. Also, what that also does is it not only engages your quads too much, but it also inhibits your glutes. Right now my glutes are not working at all. So the first thing that I like to teach in doing a squat is hinge at the hips. The first thing you want to do is let that butt go back so that your glutes are in a position to where they can actually assist in this motion. Okay, so that's the first thing. Second thing is I make sure that your knees don't go diving in. That's another thing that the glutes control. Your glute max in the back is what controls the hinging at the hips. And your abductors, your other two glute muscles, help control the sagittal plane movement of the knees. So as long as you're hinging at the hips, you're not letting your knees dive in, you're staying nice and straight. The idea is to squat straight on back and sit. And then stand straight on up. Okay, I'll show you this from the side. Same type of activity. Legs shoulder width apart, up nice and tall, hinge at the hips, sink back, and sit. And then just the reverse. Lean forward, engage the abs, and stand straight on up. Okay. Now you can obviously progress this by getting rid of the chair and just doing a squat. Down and back. Down